Marhaba and welcome to the second Nurse Leadership Forum at Middle East. I'm Brandy Scott from Dubai 103.8 and I will be taking you through our seminar today. 6 months ago, our first event focused on the challenges that COVID posed for mental health amongst healthcare professionals, nurses in particular. This afternoon, we're going to move that conversation forward, looking at some tentative planning for a post-COVID world, or at least one where we may manage COVID into our nursing and healthcare systems, and to look at what that might mean for nursing resources. Now, this topic has come directly from consultations with our steering committee, which is 25 chief nursing officers and directors from hospitals and institutions and health authorities across the region. They say that this is what we need to be discussing now, and the fact that we have more than 500 of you registered on this call today would suggest that you agree. Let me first run you through the format of today's event. We're extremely lucky to have 2 keynote presentations of the highest order from nursing professionals working at the top of their game. Aisha Al-Mari, our first speaker, is Group Chief Nursing Officer at SAHA and President of the Emirates Nursing Association. Jennifer Deeney, meanwhile, is Head of Neonatal Nursing and Operations at Liverpool Women's NHS Foundation Trust, and she joins us from the UK. We're going to hear from both women for around 15 to 20 minutes, followed by questions from you and from me. And because I know everyone is busy, we're going to keep today's event to around an hour and a half. Before we start though, I do have a few quick thank yous. Firstly, to our aforementioned steering group for all of its support and guidance. For our partners at Informa, who's providing the platform that we meet on today. Sonova Associates, who bring an international flavour, and Jennifer to this event. And of course, the forum, like our last event, is brought to us by OBIX Middle East, a business with clinicians at its very heart. For those of you not familiar, OBIX is a perinatal system used in more than 700 hospitals and 25% of all births in the US. OBIX came to the Middle East in 2017 and has a permanent staff in this region, implementing the system into hospitals with labour and delivery units. And the reason that they have created this forum, well, a big part of the OBIX philosophy is helping to educate and support nurses in all roles, which is what today's event is designed to do. To remind you that you're not alone, but part of a much wider community. Our aim today is to share experiences, draw on each other's strengths, and continue to build hope in interesting times. I'm going to finish with a little bit of housekeeping before we kick off properly. As I mentioned, the platform we're using today, which is Informa, will allow you to submit questions to Aisha and Jennifer throughout the event. Please use the Q&A format for that. We're going to be monitoring it live throughout the event. We want your questions, and I'm going to try and put as many of them as possible to our 2 speakers after their presentations. The team at Informa are also standing by to help you with any technical issues that you may be experiencing, although obviously, hopefully not. So if you are, again, please use the Q&A format to message those in, and don't worry, only the team at Informa will see those, not everybody else who is on this call. So without further ado, I would like to introduce our first speaker to you today, and that is Aisha Al-Mari. She is the most senior Emirati nursing officer in the UAE, extremely well-known name in the region, and I'm going to give you a very quick bio. Aisha has long experience in the nursing field, starting as a registered nurse at Al Kuwait Hospital in Sharjah, where she was quickly promoted into the CNO, the Chief Nursing Officer role. She's worked through senior nursing roles in the Health Authority in Abu Dhabi, at ADNOC, and was Director of Nursing at the Ministry of Health Headquarters. She then moved into Al Jalila Hospital as CNO, and then into SAHA, where she is currently the Group Chief Nursing Officer. She's also President of the Emirates Nursing Association and on the board of the UAE Nursing and Midwifery Council. In her role at SAHA, which is the UAE's largest public healthcare provider, she is responsible for nursing and strategy throughout the organisation and has 5,000 plus nurses under her daily care. And so therefore she is the perfect person to be speaking to these issues today regarding managing nurse resources and planning for a post-pandemic future. Before we hear from Aisha, we are going to first see a brief video from SAHA.
today we are so honored to release our last patients and to know what are the magnificent work that the clinical team, either nursing, either medical, or either admin, pharmacy, that our healthcare system are having. Really, no doubt, we have talented armies to be successful in fighting this battle.
In both field hospitals, we all went beyond what we needed to do, but we did it willingly, we did it together, we did it with a wonderful spirit, and gave us all the morale to keep going with the momentum till we achieved our success. One word I'd like to leave you with is to keep calm, keep safe, and keep carrying on. And together we'll achieve great success in this country.
This pandemic has brought many of my colleagues from different facilities, and this gave a very good time to work with them to improve my morale and healthcare professionals' morale and my interpersonal relationship and communication ability. The message I would like to give to the public through this video is, together we can achieve more than we expect. Together we can win. Nothing is impossible. Be strong, stay safe.
So, first of all, good afternoon.
And I'll now hand over to Aisha Al-Mari.
Thank you. It's my pleasure really to be part of this platform today for all the nurses, and thanks for the team and for the organizing team. I believe that this forum will allow really to share our experience and knowledge and lesson learned worldwide and even at the local level. Now, looking back with the way how we managed during the wave one and the lesson learned that we had, still at the all level, at the country and at the sections and the healthcare institutions, we are like alert in a way that to be ready for any kind of any crisis or situation that is unexpected, and in order not to go through the challenges that we faced last time. So we developed a kind of a framework that to be sustained in order to support the unexpected kind of a situation that, God forbid, it will happen. So if you allow me that we go and to share with you the concept of the field hospitals and the lesson learned from the last year. So the framework that we started then thinking about how we do it and overcome that challenge, especially in the workforce. We had a quite different starting up with the site visits to assess the situation and the patient's conditions, and then looking to the workforce planning and upskilling they required to support the field hospitals with the demand of the competent workforce. That cannot work separately, so the planning and the upskilling goes together, and then we start deploying the nurses. When we had a site visits to the field hospital in a different size of the country, so it was with the multidisciplinary approach. So we didn't depend on the point of view that comes from the nursing findings, but we start jointly having a nursing lead, medical lead, and the nursing informatic lead with the education lead, and that combined with the ICU nurse lead and infection control lead. So this team jointly started having a site visit to assess the situation, the condition, the type of patients, their acuity, and even looking into the infection control standards that to try to overcome the gaps in order that if we will start commissioning or operating these hospitals. Aside with that, our education team, from the lesson learned that we had last year, we started developing a framework of the training, education, and upskilling. As you know, globally and even at the local level, we are having a shortage of nursing. And not only that, even supporting our institutions with the competent, adequate number of nurses to be able to be ready with any emerging situation. When the mandate came in order to operate the ICU bed, so in the normal condition, we don't have really ICU nurses at the level of what is the demand required. Then what we did, we developed a kind of a 3-category of upskilling program. So category 1, we started having an upskilling of the nurses from the normal ward to the COVID-19 acute wards, and it's still ongoing. And category this lasts for the 5 days training. And category 2 training, it's also a 5 days training where we actually upskill the COVID-19 acute wards nurses to ICU. And category 3 training, which is lasts for 13 days, that it will be for the external candidates who we are recruiting nurses from different type of a background. And it's not necessarily that they should be ICU or acute bed nurses, but as far as or as much as she's a nurse and she fulfilled the criteria of the licensing, then we take her for an upskilling for the COVID-19 acute wards. And that's in order to fulfill the functioning and operation to take care of the patients who come in these hospitals. That framework actually helped us even to identify the model of care that it will be delivered in these type of settings. We identified, because of the situation that the country encountered before and the condition of the disease itself, where the patients can deteriorate suddenly and they're just coming to you in the door of the ER as a stable, and then with a few minutes you can see them how they are deteriorating. So identified that it should be, we should have type of beds with the acute general beds with the normal and different kind of a criteria that they can be served there, and HDU or high dependency unit beds that required a lot of close monitoring of these patients. And in case if they will be deteriorated, that means they will be shifted into ICU. So these hospitals were kind of a mini hospitals with all the supportive resources. Now, the deployment of nurses were huge until today. We make sure that the number of the adequate upskilled workforce of nurses should be on time, and they can be fulfill the required patient care safely. So we had a combination of 2 types of nurses: skilled nurses, experienced nurses from our organization, and the outsourced nurses. And we wanted really to have a kind of an approach. It is an integrated approach of skilled nurses into a different field hospitals, where the outsourced nurses will go with the different upskilling program, and they can be safely taking care of the patients in the acute beds. And the Saha nurses, we can consider them, they are skilled, experienced nurses who can lead them as a team leads, and at the same time, they will be taking care of the critical or with the high acuity type of patients. If we look aside into the operational workflows, we wanted really to make sure and sustain this type of workflow in these hospitals, because some of the hospitals are located in a way that they are far away from all the type of support from the nearby hospitals, and some of the hospitals are actually, the field hospitals are very near to the sister hospital in case if there is any emergency. So we wanted really to make sure that there are different types of a workflow in terms of the admission, referring, and discharging workflow. In addition to that, nurses really took huge responsibilities to make sure that the medical equipment and the consumables are really available, overcoming the logistics related to the availability of these equipment and the consumables in terms of the deployment of these consumables on time in case if there is a shortage of any critical items, medical equipment training, because when you operate such hospitals with big number of beds, many of the equipment are not from the familiarized equipment in your hospital. So we wanted really to make sure that all the nurses are familiarized, they know how to troubleshoot and the maintenance and the accessories that is there. And we do appreciate that the nurses really took the lead in making sure that it's there to cover even the risk that might happen during any kind of an deterioration of the patients could happen in such a location of the field hospitals. In addition to that, one of the aspects that always has been maintained and lesson learned from the last heat wave is the emergency codes. So all the codes that have been applied in a normal hospitals, we applied even in the field hospital. For example, and not limited to the red code related to fire, of code white for the patient violence, code yellow for the patient missing, and in code green or gray in terms of any disasters. Now, I just wanted really to highlight here the thing that always we know, and this is not a new scenario for nursing globally, is the shortage of nursing. And with the COVID, we realized really that it's not only the number of the nurses we are having a shortage, but even an adequate, competent, experienced nurse to manage, because it was not just in a normal patients in the quarantine or in the normal ward, but it's more about patients who are suddenly been deteriorated and you need to act fast with them. Globally, the WHO announced that almost the world will suffer, and they are in need of 6 million nurses to cover the shortage. And UAE and Abu Dhabi is not far from this. And what I shared to you previously, the framework that we realized that we did, it can be a very good framework even in sustaining and developing and retaining experienced nurses, and even having a nurse from the novice to an expert. Today, if we look into the Abu Dhabi for the nurse per 10,000 population ratio, we are in the middle. However, with the COVID, we realized that there is a huge demand for the nursing workforce. And again, I would repeat, an experienced and competent nurse workforce. So, in conclusion, I just wanted to say that there is a high demand in nursing globally, and UAE is not far from it. Thank you.
One of my kids, she's 4 years old. She told me, "Mama, are you a doctor?" I told her, "No, I'm a nurse." She said, "Okay, Mama, take care. Stay safe." I went out, and then nowadays she's telling and pretending when she plays that, "I'm a nurse, Mama, I'm a nurse," which gives me like, I'm proud that my daughter is proud of me that I'm a nurse.
We are heavily involved in all the preparation for all the field hospital, from the workforce, the nursing workforce, from the consumable equipments and the patient pathways.
We improve the patient's life and patient's family's life and our staff well-being and safety. But for nurses, I can say proudly they are the soldiers and they are working every day in the fields.
We extended a very unique service which was initiated on the crisis, which is Ahsantum card, and that was sent to all our team to appreciate their work and cooperation in our field.
One of the really touching moments of during this pandemic was seeing our last patient getting discharged from the field hospitals.
We were heavily involved in making sure the beds are available for the expected influx of cases that would be admitted, which has happened already. We have trained many staff to make sure that the discharge planning going smoothly and we don't have a backlog of patients.
Or we could handle this situation very well by means of staying safe, proper physical distance, proper infection control, and connecting with others.
I was very happy seeing the patient walk out of this door from the field hospital, and this is our reward and for all the effort that we have done, and this is the thanks for all of us.
Aisha Omari, thank you very much for that. I'm going to have a bit of a chat with Aisha now for the next 15 minutes. Putting questions to her. If you do have any questions for Aisha, this is your call. And to me, use the Q&A function that is there on your platform, and I'm going to get as many of your questions to her as possible. I can see those questions are already coming in. If you see my eyes darting left and right, that is why. Aisha, there's a question that a couple of people have asked, so I'm going to paraphrase, and it's actually a really good place to start before we get into the nitty-gritty of nursing resources, which is to ask you, as we hear from Europe of second waves and third waves, your gut feeling that we are in this pandemic at the moment here in the UAE?
I did not hear your question clearly, Brandy. So are you, is the question related that we are in the second pandemic here in UAE?
Yes. Where do you feel we are in the curve?
Okay, now let me tell you here, the blessing that we are having here in the country, our visionary leadership, and the leadership always predict and act proactively before that we go to the situation we are not able to control. So the lesson learned from the wave one, actually, the leadership and even the decision maker and the healthcare institution jointly work together in a way that to be ready for any emergency and any unexpected situation. We can't say that we're in a second wave because all the data and all the numbers reflect that we are in a very good shape in controlling. And this is not because of the healthcare sector, but I think the multidisciplinary approach that came from the different sectors, and I talk about the municipality, the tourist, the education, where there's a lots of very good, well-controlled rules and regulations, were helped really to control the situation compared with the other global countries.
So what does being in that second wave mean for nursing resources? How do the challenges of this stage of the pandemic differ from the first wave for you?
Yeah, so here at this stage, we are proactively working in an order not to go through the resource challenges that we had in last year. As I mentioned earlier, the shortage of nursing and the time that required in order to upskill the nurses. So what we did here, proactively, we are trying to maintain the resources availability in terms of the workforce required of nursing. So extensive work has been done in terms of recruiting the number of the nursing workforce. We are as well utilizing the time factor to make sure that all these nurses are upskilled, trained, educated, exposed to the different hospitals, where actually there is no emergency situation now, but they are in the field, hands-on clinically with the skills required. So when there is a call for duty, they are ready. Because in the last wave, the factor, we were actually fighting with the time. The time factor was really critical for us. The number of the patients are increased. On the other side, we are trying to prepare the nurses, be ready, recruiting the nurses to make sure that they are being deployed in time. Now we are proactively working 5 steps ahead, where even if there is, this is a normal condition, but in case if there is a situation that urged us to be all standby, we are there ready. So that's why the resources get planned very effectively, efficiently, making sure equipments are ready, consumables are ready, everything are there in place.
Okay, one question that I've received 3 times now from different professionals. When you talk about the demand for more nurses, people are asking, how do they actually apply to be part of your team?
Well, there is lots. We use actually the social medias. We use our websites. We use even we get the support from the Department of Health in a way to make sure that all the nurses who is a registered nurse either in her country, in native country, or even here in the UAE, regardless of the experience, regardless of the clinical exposure, she's most welcome to join the COVID team, the COVID fighter team. And if you look into the website, the social media networks that we use, because we believe that this is more accessible, approachable to the population, where it's like ready to apply and to join.
Okay, the questions coming in thick and fast. Thank you so much. Please keep them coming. Here is another one that we've had a couple of times, Aisha, which is, how are you making sure that the upskilling that happens is the correct upskilling that we need, so fit for purpose? And are you accrediting it in any way? How are you evaluating the skills that are being acquired?
Yeah, so we worked actually very closely with the Department of Health, and because they are our governance structure, governing body in terms of regulating, and the part of the education comes under them as well. What we did internally, the education team with the subject matter expert, the clinical resource nurses, and the nurse educators, adapting the theories and evidence-based way of having an upskill program. So as I mentioned earlier, we have 3 categories of upskill program. We focus into the competencies and skills of the nurses. We use, even because of the COVID restriction, so we had hands-on skills of the nurses clinically in the hospitals, and theoretically by using the virtual approach. Now, how we actually observe that, this is not actually a normal situation, this is an unusual situation. If you can imagine an ICU upskilling program that in the normal situation takes 3 to 6 months, we reduce it only to 2 weeks, just to make sure that the basic upskill competencies the nurses are ready to handle. Monitoring that by supporting our field hospitals with the adequate clinical resource nurses and expert nurse leaders from SAHA, where they are going to lead this group of nurses, and to make sure that they are delivering a safe content. And in addition to that, an essential training program ongoing from last year till now, and we are enrolling the nurses again to a refresher course, just not to forget and to refresh their mind and their hands onto the basic and important competencies.
Okay, here's one more question that, again, I'm getting multiple times from different clinics and different people, thank you, to these upskilled nurses or your newly recruited nurses once the pandemic is finished.
What we will do with them? Is that the
yes.
Question? Okay. Now,
yes, what happens to them? What happens to their skill level?
Yeah. So one of the things that we have 2 types of nurses. We have an experienced nurses from our SAHA healthcare facilities, who are our permanent nursing staff, and then we are having an outsourced nurses who are being upskilled. And what's going on around us globally, we know that until our vaccination program will be ending up successfully, we still have to be standby for any situation. This is number 1. So we need to make sure that these nurses are available, will be educated and upskilled adequately. Number 2, actually they are being integrated and merged with our SAHA healthcare facilities in a way that they also be shadowing our nurses. What will happen later on? This is the plan that it's not, we don't think so that will be finishing very soon, but they are being part of our SAHA family. They are being part, even been supported by our governing body, the Department of Health. So they are part of the nursing workforce in SAHA.
So even those on short-term contracts, are you saying will be absorbed into SAHA, or?
That's very early to answer these questions, but we keep monitoring the situation, and we keep monitoring the guidance and the instructions that comes from the healthcare leadership. And we are just planning, focusing onto the managing and controlling the pandemic now.
We're getting a couple of questions, Aisha, about vaccination, which is interesting as well. As we move through the phases of the vaccination drive, and there is talk about whether or not we will need maybe boosters every year or 6 months. How does that impact your nursing resources between the public and the private sector? How do you potentially see that working?
So I could not get exactly the question. So it's about the vaccination and how it's impact between the vaccination campaign and between the private and public sector.
Sure, sorry, I was a little convoluted there. As we move potentially into booster vaccines and then maybe annual vaccines going forward, what does that mean for resources? Do you see the public sector taking that, maybe going into the private sector nursing? What do you think might happen?
I don't think so that we have such conversation, such kind of an approach here, because the vaccination campaign is well supported by the leadership here. And it's actually in a way that everybody should be vaccinated. It's mandated that everybody should be vaccinated. It's regardless if the healthcare provider are from the private or public sector. The frontliner, it was the first direction came that the frontliner, all of them need to be vaccinated because it's a part of their protection and even for our community protection. The public and private sectors are working together. We move together in a way to achieve the expectation and the objective of the leadership guidance. I don't see that there is an impact negatively in the resources, but I see that actually we are achieving the target that everybody in the community needs to be vaccinated, and the frontliner are the one that need to be prioritized in addition of the other target group from the population, without any kind of preference if it is from the private or public, but you are a healthcare provider, a frontliner, so the priority is for you.
Okay, we're getting some great questions in about encouraging more nurses into the profession. People are asking, how do we get the next generation into the profession, and how do we get more Emirati nurses into the profession?
The good thing that came from the pandemic, and actually, however, before the pandemic, the leadership always were reinforcing in supporting and emiratizing the national workforce in nursing. But with the pandemic, what we noticed actually, and especially this is post-pandemic kind of a direction came from the government, that to develop a strong type of programs that will encourage our young generations to join and enroll in nursing. A wonderful initiatives that have been generated by different healthcare sectors. We can talk about Department of Health, Ministry of Health, and even been supported by the country leadership by a call and a very kind of a motivated messages about the importance of the role of the nurse. The academic institution in the country even jointly started induction lots of the nursing program, in addition of programs that it will be directed and dedicated to the secondary school students. There is even a lots of the small programs that has been under study with the support of our academic institutions to help even the students who are actually enrolled in different programs aside from nursing, where we have to add a kind of a small curriculum in nursing in order that to raise their awareness in healthcare. Second thing is that to open a track for them if they would like to join nursing. We are part of a lot of initiatives now, and I believe that was a very good advantage came from the pandemic, because everybody realized the important role of the white armies, as we call here in the countries, mainly the nurses.
Okay, final question for you. I know one of the UAE's ambitions is to become a world-leading nursing centre. What needs to happen now to make that happen? What's the next step there?
The ambition actually always that we would like really to be pioneer in terms of the model of care that we are providing for our patients, in terms of having an putting our Emirati nurses or nurses in UAE in the global map. One of the initial startup steps that we did under the umbrella of the International Council of Nursing were we tried really, and it was successfully by hosting the important Congress of the ICN to be in Abu Dhabi this year. It is the first time that's happening in the region, and we were really successful with all the leadership support to put the UAE nurses in the global map, and not only the UAE nurses, but even the nurses in the region. And that's similar to the midwifery profession, and we talk here about the ICN Congress. So that is not about the Congress and having a platform where the nurses will come, but it's actually in order to strengthen and reinforce the position of the nurses and the midwives and policy making, strategic planning, and the direction at the higher level at the healthcare sector. We are even been part of the global talks in terms of under the umbrella of the WHO in putting the strategic direction for the nurse and midwife to 2025. I think lots of initiatives, and the UAE represented from Emirati nurses, we are proud about them, who talks about nursing and the nursing profession outside, to have a spotlight of the really about the nursing profession and how the model of care and the practice that we are doing. There is a lot of revision going on, even related to the scope of nursing. Currently, we wanted to broaden the scope of nurses and midwives, and to be aligned with the global expectation. Lastly, I think hosting some of the hospitals, especially like, for example, the Cleveland Clinic Abu Dhabi, who are the first hospital with the magnet accreditation globally. This is kind of within the region. It was a good credit for all the UAE nurses, and similar other hospitals are actually taking that steps ahead.
Aisha Almari, thank you so much. Please stay with us, because we will be coming back to you at the end of the session. But I will now be introducing our second keynote speaker, who brings her international expertise to our event, as well as her significant nursing and management experience. Jennifer Deeney is Head of Neonatal Nursing and Operations at Liverpool Women's NHS Foundation Trust. And I'm going to share a few highlights of Jen's career with you and not do it justice. I'm going to start with St Bartholomew's Hospital in London, famous the world over as simply St Bart's. It's going to be celebrating its 900th anniversary in a couple of years. And Jen's career involves serving as operational manager and matron, as well as leader for the London Neonatal Transfer Service. Following nearly 3 years as matron of neonatal services at Royal Sussex County Hospital, she has been for the last 5 years head of neonatal nursing and operations at Liverpool Women's NHS Foundation Trust. Jen there is responsible for operational service delivery, human resources, financial and risk management, and ensuring excellent quality care in one of the UK's largest neonatal services. That includes taking leadership and operational responsibility for tertiary neonatal services across Liverpool and working at Liverpool Women's Hospital and Alder Hey Children's Hospital. Now, this experience is one of the reasons that she was invited to sit on the board of Sonova Associates, who have, for the last 25 years, provided nurse leadership training and events to hospitals across the US. And some of you will be familiar with Sonova's NICU Leadership Forum and the Perinatal Leadership Forum. Sonova is now working with OBIX Middle East to help deliver the content for our forums, the Nurse Leadership Middle East Forum. Right, Jennifer Deeney, over to you.
Good afternoon, everybody. I'm Jen, and I'm the Head of Neonatal Nursing, as Brandy just said, at Liverpool Women's NHS Foundation Trust and at the Liverpool Neonatal Partnership. I'm also a member of Sonova's Executive Advisory Board. My role is the strategic and operational management of neonates across Liverpool. We've just completed our new neonatal unit on the Liverpool Women's site just in time for the pandemic, and we're now in the process of setting up a new service, neonatal services Alder Hey, and building yet another new neonatal unit. This service will be delivered as a partnership, and that in itself is a huge challenge, but the bigger challenge has been to keep this piece of work going, continued throughout the pandemic. When I was first asked to do this presentation, my first thought was really I haven't been forward-facing enough, because as a women's hospital, we didn't see the sickest of COVID patients. But I took some time to reflect on that and reflect on this last year. And I can see that regardless of what part of this pandemic we have seen, I can say it's impacted on us all and in very different ways. And with that, we all have a value to add by sharing our experiences, processes and learning. And this will help us. This will be fundamental in helping us in the future to ensure that we define the way we approach further pandemics and world crises. Now, when we started this, we were starting a marathon that we didn't know we were going to run. So we were all led quietly and gently into the COVID-19 situation. Something that was happening in China, not much to worry about. It was going to come and go just like the avian flu and the swine flu and Ebola. And we as a NHS team knew we could contain it, sort it, and you know what, in a few weeks we'd move on to the next thing. But this stayed around a little bit. It brought a little bit more buzz and excitement with each day, and as it started to gather a little momentum, it became a more frequent topic of discussion. However, we still thought this was a sprint and we could see the finish line. But as February ran into March, the realization set in that rather than de-escalation, we were heading into escalation. And if we use that marathon analogy, you know, at this point, we didn't think we were going to be running 26.2 miles, but we started that journey and we were definitely on a marathon. The NHS is one of the largest employers in the world, 2 million employees. While each hospital has its own business identity, we're governed by the Department of Health. The NHS deals really well with the crisis and quickly, efficiently and effectively puts measures into place to manage any major instance. This is always done in a well-orchestrated and structured manner. However, local delivery changes from trust to trust. Within our trust, we started the weekly updates and discussions about what was happening regionally and nationally and globally. Conversations started around PPE and how we would monitor patients who came in needing our care. Would we allow visitors in? What were our plans about staffing? And what would happen if that positive patient came? Then came the birth of the first standard operation procedure in relation to COVID. Move on just a couple of weeks, and we were told we were in a global pandemic. Started to spiral, and we got our first national lockdown. And with this, the NHS went into command and control. What this means is control is taken centrally, and any decisions can't be made without the approval of up at government level. It also means that decisions that come down must be implemented in the expected time frame. This quickly changes the atmosphere and the expectation, and with this the pressures begin to increase, and as leaders we start to feel this. There's daily meetings. We need more standard operation procedures. Things, rather than having a week or a month to turn something around, we had days and hours. Our staff we sent home to shield those that were vulnerable. Our pregnant girls who were working, they were sent home to shield as well. And all of a sudden our staff numbers began to drop. We had pressures on PPE. Who was fit tested? Could we get the masks? Could we get the gowns? Could we get the gloves? And shortages were starting to happen not just nationally, but globally. And there was worry and concern. And social distancing arrived. Whoever thought that 2 meters could cause such headaches? Trying to get people ready to work at home, which we weren't set up for. In the NHS, we expect people to be in. So getting laptops and computers and teams up and going. Looking at our environments. And I think if you look at our environment, I told you that we built a new unit. We moved in a month before pandemic hit. If we hadn't moved in, we would have % of our capacity to maintain social distancing. Not only would that have been disastrous for our trust, but it would also have been disastrous for the bigger health economy. Because where would these babies go? To move to decide whether we would have visitors or didn't have visitors. Did they bring risks? Didn't they bring risks? Challenge. and it was continuously changing. But NHS workers became superheroes, just like the Marvel creatures in front of you. As carers, we jumped into action. We wore the PPE. We looked after the sickest patients. We reassured our families. We changed the way we worked. Nurses picked up those extra shifts. They worked longer hours. There was no tea breaks, lunch breaks. We started with everybody wanting to help. But slowly, not only did COVID start to take hold of the general public, but it started to take hold of our most precious resource, our staff. Numbers on shifts started to fall. PPE became a struggle. At LWH, we were really protected because we didn't have really sick COVID patients, but our staff were as vulnerable as every other staff. And that's when the pressure really began to build. And as our resources became stretched, you know, it became more difficult to get hold of those PPE, became more difficult to get those extra staff on. But we persevered because we knew we had to. We knew we had to look after our patients. But once we went into command and control, the pace changed, and the expectation not only on our staff but on our leadership teams changing. You just have to look at this, and this is just a really slight selection of what we with on a daily basis. Stay alert, stay home, visitors allowed, visitors not allowed, business as usual, stop all elective work, wear masks for AGP, wear masks for everything. It changed continuously. I remember one Friday afternoon meeting, and I was chatting to my team about PPE and visiting. And I spent 30 minutes reassuring them that we were doing the right things and this was all for the right reasons. And I left that meeting feeling that they knew what was happening. To get a phone call the minute I stepped outside the door to say it had all changed and I had to redo everything again, o'clock on a Friday afternoon. I began to dread Fridays. But as a leader, it was my job to be confident and reassuring and lead my team with the best clarity I could. I needed them to trust me, so I was always open and honest and clear, as I had to be sure they could practice with confidence. But one thing probably we don't look at as leaders is our own personal resources. And as a leader, only weeks into that demanding continuum of change and the huge weight of responsibility, it was exhausting. But we didn't have a choice. We had to keep going. I think this slide really says it all, doesn't it? In the middle of this, the pressure was high. You know, our staff morale was dropping. Their ability to do their job was pushed because they didn't have the resources that they were used to. We banged on about standards, and yet we were asking them to work at the limit of those standards. The families we care for were pressured. You know, we were asking them not to include their families. We were asking them to limit the amount of time they spent with babies at times. We worried about our own families. Here in the UK, children of healthcare workers still went to school, where we told other families that they shouldn't send their children to school, and that was a conflict and something that we had to deal with. We look after gynae patients and maternity patients in this hospital, and some had operations cancelled that they'd waited months for. You know, some came into hospital and they weren't allowed to have anybody with them to support them and help them. Equipment was tight. As I told you, we moved into a new neonatal unit and we just replaced all our ventilators. And one day I got a call from the adult intensive care on the adult hospital site to ask could they have our 20 old neonatal ventilators because the resources were just so tight and they didn't have the capacity to ventilate the people they needed to. Things changed. We opened Nightingale hospitals. You'll all be familiar with these pictures of that pressure. These are the images the world and we are familiar with. And they truly tell the tale of the impact COVID has had on our resources. But through it all, and those weeks and months, we as key workers were so privileged to have the support and kindness and generosity of the public behind us. My little boy's nursery made this poster of their handprints and brought it into us. We got pizzas, we got cakes, we got treats, and it was really lovely. And at a time when our morale was dipping, and this rainbow symbol gave us support and unity, and it buoyed our teams. And it's something that will stay with us forever and a time. But time spiraled. March became May, May became September, September became November. And as we sat in the lull of wave 2, wave 3 came with us with a ferocity that we weren't expecting. And even though we'd been through the harshness of wave 1 and 2, wave 3 brought a devastation that we just never even thought about. We'd maintained all our resources and physical resources in 1 and 2. But wave 3 wreaked havoc on our most important resource, that of our staff. Our numbers dropped. More people went off shielding. More people had to isolate because the virus became more virulent. We added winter colds to that, fatigue, anxiety, stress, depression, because people were tired. Our most valued resource was on the brink of devastation. You know, we pleaded with the public to stay home, to follow the rules. But they were tired and fed up too. But as a nurse, and not being nurses, they'll never understand the devastation of looking at those numbers rise day in, day out, and watching those people die day in, day out, and wondering, when is this going to stop? And the heartbreak in those numbers. That's when compassion fatigue starts to hit. And this is something that we're just touching now, isn't it? I found a really great explanation by Dr. Remen, and he explains to us that compassion fatigue is like the expectation that we can be immersed in suffering and loss daily and not be touched by it. And that's as unrealistic as expecting us to be able to walk through water without getting our feet wet. Not possible, is it? And that's what's happened this last year. And what we must remember is that suffering and loss can mean different things to different people. For us on the NICU, to change from a family integrated care model, only mums and dads can visit, nobody else can come in. You know, I remember sitting with families and saying, Mum or Dad can visit, you both can't visit. I can't tell you, but that was the most devastating day of my career. It broke me, I cried. It wasn't the way I was taught to nurse. It wasn't the way I was taught to care. And yet it kept coming and kept coming. And it's when we hit that point, past burnout, that compassion fatigue really sets in. And this is the reality that we're all heading into. When the dust settles and the hype and the adrenaline rush settles, from being heroes is over and we go back to COVID becomes business as usual, we will see our greatest resource struggle with compassion fatigue. Some of you may already be experiencing this or see it within your teams. Know that it's okay not to be okay. You know, there is help out there, and with support and kindness and great leadership, we can make it better. As leaders, you will see great nurses leave the profession. And this will be for a variety of different reasons, but the background will be the COVID and the pressures from COVID. The profile of our staff within the NHS is older, so we will see individuals take early retirement. And this impact will be seen for years to come within the NHS, and I'm sure within the wider global healthcare economy. Mental health is a huge part of COVID-19 and a huge part of something that we're going to have to manage going forward. We know alongside compassion fatigue, we will see post-traumatic stress. We will see more anxiety and depression related to the experience of our staff during this pandemic. We will see those that have shielded come back into what's our normality now struggle and see their anxiety soar because they just are so afraid. The UK government has recognised this, and in its NHS People Plan, it's committed to spending £15 million to try and help before this crisis actually reaches a crisis point. Some of the initiatives our trust has embraced is the Schwartz Rounds, and this is to help create a safe space where staff can come and talk and look out for each other and share their experiences. We've created a wobble room somewhere where people can go and talk and just chill out and step away from reality just for a few minutes. Sonova has spent a huge amount of time doing debriefs and looking after the staff and town halls so people can talk and really get their impression of what's happened over the last month and their views and share their thoughts and feelings, because sometimes talking really does help. But we also need to take this time to applaud ourselves for the things that we have done really well and how we move out of this. I know for us, one of our biggest things has been technology. We've really embraced technology. And that's one of the total upsides of COVID, has been our ability to do that. I'm sitting here in a cloudy 6 degrees in Liverpool presenting to you all in very, very sunny Dubai. I'd much rather be in Dubai. But whoever thought we would do this 18 months ago? We've managed to keep our teams together by using Teams meetings, Zooms parties. And this has been a lifeline for many. Will come soon, because we all get fed up of sitting in front of a computer all day. But it has been the thing that's kept us together. One of our biggest successes during this pandemic at Liverpool Women's Hospital and at the partnership at Alder Hey has been using telemedicine. And for our partnership to thrive and to continue on its journey to fulfillment, we had to implement this in less than a week. And we did. It meant consultants that were shielding at home could still be part of the team and deliver ward rounds. It meant parents who were isolating could be in on the ward round with their babies. It meant that allied health professionals could observe babies that they couldn't necessarily get to. It's changed the way we care. And it's not something that we're going to lose, it's something that we're going to keep. This is a picture of our consultant surgeon, our nurse consultant Sue, and our consultant neonatologist Bill, who's on the computer. We call him Bill on a stick now, after this picture. You know, we can't talk about the pandemic and COVID-19, can we, without mentioning finances? COVID-19 has and will for years to come change the NHS. We are nowhere near knowing the true cost of what COVID has cost us and will cost us. But we can already feel the pinch. I've just sat in our yearly planning budget meetings, and we can see already that we don't have what we had last year. You know, we're going to be challenged to think differently. We're going to ask to be innovative, and we're going to be asked to use our resources differently. But after the year we have had, I'm confident as nurses that we will, because of what we've learned, and because we are resourceful, we are smart, and we're definitely innovative. So what next? For me, this is the time we reboot and rebuild our teams. And for this to happen as leaders, we must have a focus on health and well-being. Our work environments must feel safe, and they must feel safe from a physical health point of view, safe from a mental health point of view. We must utilise the services available to us: resilience hubs, wobble rooms, psychological support, Schwartz rounds, gym classes, yoga, mindfulness, choirs. Lots of things have happened over this last 12 months, and we mustn't lose sight of those, and we must grow them and build them. And these will help us improve and sustain our mental and physical health. We need to rekindle our communities and build all our work relationships. I don't know about you, but I know here in Liverpool Women's, we've missed our unit buffets and our dates in the park and our nights out. It's where we socialise, isn't it? And we can never underestimate the importance of food, can we? I've worked with nurses from all over the world, and we all love food, and that's not just because I'm Irish. I'm going to hope that you agree with me, but I think my Indian and Filipino nurses give us a run for our money when it comes to food. What we just need to remember is health and well-being is all-encompassing, and we have a role to play in ensuring help ensure that balance for ourselves as leaders, because if we don't look after ourselves, we won't be able to look after our teams. A 150 years ago last year, Florence Nightingale said this quote, that it would take 150 years for the world to see the kind of nursing she envisioned. You know, last year we had parties planned, we had award ceremonies planned, we were going to carry a lamp around, we were going to do historical talks and talk all about Florence Nightingale. 12 months on, we've come to learn that none of that is important, that doesn't matter. Because you know what? We did see what nursing is all about in these last 12 months. We've seen that nursing is resourceful. We've seen nursing is confident. We've seen our nurses are intelligent and innovative, but most of all, they're caring and kind. And what more could Florence ever want than that? You know, I think in the 150 years on, she would have been so proud of each and every one of us and the challenges that we've undertaken this year and how we've managed them and fought them. 2020 may have been the year of the nurse. And yes, we saw it. The world saw it. We lived it and are living through it still. I'm just proud that I'm able to sit here today and say something that I learned at a Sonova conference 2 years ago, that you are all magnificent. You have all done an amazing job. I am proud to be one of your leaders. But more than that, I am proud to be a nurse and proud to be part of the team of nursing and the global team of nursing. Let's keep moving and nursing forward. And in 150 years, may they look back and see what a great job we did in 2020. Thank you all.
Jennifer, thank you so much for that and for joining us today from Liverpool. If you have any questions for Jennifer, I've got a good 15, 20 minutes with her now. I'll be putting my own questions to her. And as before with Aisha, I want yours as well. We've got a lot of people messaging in, by the way, Jennifer, to say how much they just enjoyed your talk. Let me start with you with the same place that I started with Aisha, which is to talk about the phase that you are in now. For those who've been watching the news, they will know that Britain is now starting to look at its phases of coming out of lockdown, maybe even coming on holiday to Dubai, legally. Tell me, what does that pose for you? What challenges does that pose for you and your nursing resources?
I think that we're in a more positive position now that my nurses are starting to come back to work. I think the challenges that will pose going forward is how we manage reintegrating the way we used to care and making our staff feel safe, that it's okay to have those visitors back in, that we're starting to relook at how we manage our infection control policies, how we reduce our usage of PPE, and what needs to stay and what doesn't need to stay. So I think there's a lot of unknowns yet, but we're in a positive space that our resources are coming back together and we are heading back to that business as usual. But we also need to understand that COVID is going to be part and parcel of business as usual going forward. And it's how we temper that and manage that, I think.
How do you temper and manage that, Jennifer? How do you take the future of COVID as a given into a hospital practice, into a trust?
It's a really good question, and I think that's the unknown path we're treading. IFRAM is going to give us a huge reassurance that we can maintain some sort of stability. We've got 8 of our teams vaccinated now here at Liverpool Women's and Alder Hey, and that's a huge reassurance to those coming back in. I think it's about process, and I think process is very important with this, and as clinicians we like to know that there's a process and that process is followed, and I think that will form processes in actually the way we address business as usual, the way we address our IPC, also our infection prevention and control, and how we manage those little outbreaks of COVID that we will still have, and that we manage them safely. Ensuring that staff are aware and trained and have the right skills and competence to be able to deal with the patients that they're faced with, and that they're working and confident in the area that they're in, I think is really, really important as well. I think, again, about well-being of our staff and actually ensuring that we make sure that they're in a good place at work, so that when they come in, they feel safe, they feel reassured, and they feel confident to carry out their role. And that is getting back on the looking at training, looking at opportunities of development, and bringing the excitement back into nursing, but in a very different way.
I was struck, Jennifer, watching your presentation by the pictures of the Prime Minister, Boris Johnson, and of Matt Hancock as well. And I realised that, of course, one of the big differences possibly between the way the pandemic has been responded to by the public in the UAE, maybe in the UK, is that it's less politicised here. Decisions aren't necessarily debated and don't become political issues. How have you protected your nurses, your staff, their morale from that dissent and that politicisation of coronavirus?
That has been a huge challenge. So it has been a huge challenge, but we started off with a very open policy. So we had very open and frank conversations from day dot. And I think, you know, if something doesn't come as a surprise and our teams know what's coming before it comes, on a kind of media platform, I think that gives them assurance that their leaders are in control. So we had very open and frank conversations. I remember one of the first conversations I had with my team was saying, you know what, there's a red line. We may have to nurse below that red line, and this is what it could look like. This is how bad it could really get. And you know what, there was tears in that meeting, and there was, how are we going to do this and can we do it? But actually, when things got really bad, they weren't in that state where it was unexpected and why didn't you tell us what was coming? Because they were already prepared. And I think that's what's important. I think it's about being open and frank and making your team part of those conversations, so that they're not, the board is here and the team are down here. Those conversations in the middle are happening. And I can't overemphasize the importance of that, really.
You mentioned Florence Nightingale there, and there's an argument that, as well as being, well, the first nurse leader, that she was also the first nurse statistician, that what she did with data collection and analysis was truly pioneering. Obviously, during coronavirus, we're working with incomplete data in real time. I mean, you mentioned budgeting there, you mentioned planning and resources. How have the challenges of incomplete statistics and that real-time data affected the way that you've been able to plan in coronavirus?
I think on a day-to-day operational basis, I don't think it's had a huge impact on us, because, you know what, we've just had to get on and deliver the care. I think what we have learned, and I think what we will learn into the future from a financial impact, is that it will have to change the way we work. We will absolutely have to change the way we work. And I think what this will give us and what COVID-19 will give us and what we may not get out of it now, the pandemics, we know they will come. And actually that data and that information that we've collected throughout COVID-19 will form the basis of where we go in the future and how we work in the future. And I think what we will see come out of this is task force, both here and in the UAE and in the America, planning for the next pandemic. And we won't go into it in the whirlwind and the unknown like we did this time. And I think that's where the strength in the data that we've collected this time around will come into its own. Has it shaped the way we have done things in the last 12 months? Not really. Maybe in phase 3 we got a little bit more of an insight into what was coming, and we could do a little bit more predicting of what we might see and what we wouldn't see in relation to patients and in relation to staffing. But I feel like the true usefulness and strength of that data will come the next time we hit a pandemic.
Well, here's a question from the city that you are currently sitting in Liverpool, asking if there's anything that you would have done differently.
That's a really good question. Is there anything I would have done differently? I think I said this in my talk, one of the hardest things, and it was a decision that came centrally, was having to say to parents that only one of them could visit at a time. I think was the most difficult decision and the most difficult conversation I've ever had to have in my nursing career, and one that I never imagined I would have. I think it's even harder not to have that conversation if I had my time again. I did fight, but I think in hindsight now I may have fought even harder. I think there isn't a lot I would change about, because you know what, hindsight is a great thing. But I would, you stumped me with that one a little bit. No, do you know what? There isn't a huge amount I would change, if I'm completely honest. I think my team, we did a great job. We kept our families and our babies safe. We kept our women safe. We did what we thought was best. And actually, you know, have we learned? Absolutely. Are there different things that we can put in place to make things slicker? Yes, there is. But would I have changed fundamentally what we have done? No, I wouldn't.
There's another personal question I'm going to throw at you, Jennifer. Before I do, by the way, if I'm frozen, it's me, not you, to anyone who is watching, and as long as you can hear me, that's all that is necessary. Another personal question that we've had in for you, Jennifer, from a couple of people, I'm going to sort of amalgamate the question, if you like, is what you've done yourself to battle your own compassion fatigue, to battle any burnout that you might be facing, and what have you done to make sure that you are okay in order to work with all of your teams?
That's a really great question. I've ended this year with, I get about 340 hours annual leave a year, and I've ended this year with 150 hours annual leave that I haven't taken. And probably going back to the last question, if I could do something different, I'd look after myself much better. I think I didn't step away. My phone was never off because I felt I had a responsibility to my team to keep them safe. And I think what I have learned now is actually I didn't think about myself and my own family. I'm a single mum to a little boy. He went to school throughout all of this. For me, I didn't step away as much as I could. So did I look after myself very well as a leader? No, I didn't. What I did find really, really useful, and which I did do at some late evenings, was join the Sonova debrief groups, and talking to other professionals and other leaders really helped me. And it helped me balance out that, you know what, I wasn't doing a bad job, that I was doing okay. And, you know, I hadn't got things wrong. And actually, to hear people say, oh, I wish I'd done what you'd done, does make you feel a lot better. Support from my colleagues was really invaluable, so it was. But do I wish I'd managed myself a little bit better? Yes, I do. And I think going forward, what we learn is sometimes to give your best, you actually have to step away for a couple of days, and you have to take that time out where you take a break. And it's okay to step away. And I think as leaders, sometimes we struggle with that because we worry about everybody else and forget about ourselves. And what I've learned is actually it is okay to step away. And by stepping away, you're not only helping yourself, but you're allowing yourself to come back even bigger and better and stronger.
Well, speaking of looking after mental and emotional health, you mentioned that $15 million there. Sorry, £50 million, quids, that's been earmarked to tackle some of the issues that nurses might face post-pandemic. The wonderful words post-pandemic, PTSD, post-traumatic stress disorder you mentioned there as well. How best would you see that money spent?
I think there's huge value in psychological support, and I think that's one of the biggest things. People want to talk, people want to share their experiences, and Schwartz rounds are a great way of doing that in a very safe environment where you can sit and listen to people and you can talk to each other. And relay your experiences without judgment or without question. So Schwartz rounds are really great. I think we've seen the design of the resilience hubs here in the UK, and that's where people can access and go and find ways to help them build their resilience. Things like mindfulness, diet classes, yoga classes, talking therapies, all that sort of stuff. And I think that is a really, really important part of it too. I think the importance of those debrief sessions, even if somebody just goes to listen to them, having access to those debriefing sessions, and again, like the Schwartz rounds, just being able to chat it out makes a huge difference. You do have a different cohort of nurses as well who are like your intensive care nurses and those who have absolutely faced it head on, front on in the COVID wards. They will need more intense support and therapies, because they will suffer from post-traumatic stress. And we have to learn how to build those nurses back up again, because I think it would be a shame if we lost them on the back of that. So we not only have to build our nurses' mental health and well-being up, we've also got to find other avenues for them to retrain and rework in so that we can keep that expertise and knowledge within the nursing profession. And for me, that's really important as well as the mental health, because we know if you're in work, your mental health is better. So finding the balance between the two and having new areas for these nurses to go in and see their value and their worth in a different way, to me, would be really, really important.
My final question for you, Jennifer, and then we're going to pull Aisha back into the discussion and finish with a few closing remarks from both of you. You mentioned they're keeping nurses in the profession, and one of the things that I spoke to Aisha about earlier was about encouraging new nurses, a new generation of nurses into the profession as well. How do you think COVID will affect that? I mean, and of course in the UK we've had everything from clapping for carers to debate over pay rises for nurses. So how do you make sure now that nursing is still seen as an attractive profession on all those fronts?
Well, we've seen a surge in trainee nurse applications in the last 12 months of people wanting to join the profession. And that's really, really great. But my worry is that might be lost in the drama and the adrenaline and the excitement of a pandemic. Because that's not what nursing is like on a day-to-day business. It's not what we do. It's a very different role. I think for me, and this isn't just in the UK, I think it's globally, we need to start recognising nurses as the professionals that they are. Our nurses are highly qualified these days. Most nurses are coming out with master's degrees. Most of them are specialising. And I think one of the things, and you mentioned it, is pay. Pay has to reflect that, you know. And currently, I don't think our pay system in the UK necessarily reflects that. I don't think it's terrible, but I'm not sure it reflects that. I think we need to find pathways for nurses to follow that don't just take nurses from the cot side and into other more fancy roles, but that we keep nurses at the cot side but develop cot-side nurses into something else. I think it's also about encouraging those unregistered staff in and how we can develop them from a more junior level up into a more senior unregistered level, and then follow them through and bring them into registered level. Our hope here at Liverpool Women's is somebody who joins us as somebody who washes incubators, goes into our clinical team, starts looking after babies. So you start as a band 2, you move to a band 3. Band 4, you're still unregistered, but you're starting to work within the clinical areas, in the intensive care rooms. Then you go on to become a registered nurse, on to be qualified in speciality. Then you go on and become a nurse practitioner. You become a head of nursing. You get your master's, you move on, you get your PhD. There's no reason you can't be the next director of nursing. And that's what I think the profession now needs to embody. We need to start at not just the registered nurses, but those who are non-registered, and find out how we bring them through on that journey.
Jennifer Deeney, thank you very much. Aisha, I'm going to call you back in now, and I would like to just pose one question to both you and Jennifer to finish off our session today. We've only got a couple of minutes left. So Aisha, if you're still with us, I'd like a few closing remarks from you on the topic that we are here to address today, which is, you know, planning for post-pandemic life in terms of nursing resources. What do you want the nurse leaders and the hospital directors who are on this call today to take away? What are the next steps?
I suppose, right, yeah.
Okay, Aisha, we seem to have lost temporarily in terms of feed. Jennifer, can I put that question to you then? Given the title of today's talk, Managing Nursing Resources and Planning for Post-Pandemic, what is next on your to-do list? How do you start making, I mean, I hate the phrase the new normal, but how do you start this new phase of your planning?
So the new phase for me starts with rebooting my team and getting my team back together again and making them feel like, you know what, we've been through the mill and actually now we're on the next phase of our journey. And so for me, that's a huge part, and it's about building that community up again. I think then for us, it's about putting plans in place that if another pandemic hits, you know, what does that look like? How do we use the plans that we have already have, and how do we keep them fresh? Because, you know, 12 months from now, they'll become stale. So how do we keep them fresh, and how do we keep them renewed, and how do we, you know, make sure that we don't lose sight of this could come again, this could hit us left of field again. And I think if the pandemic has taught us anything, it's taught us that we need not be afraid. I sat in a conference by that Sonova were running around, and Laurie Armstrong spoke, and she said something that really, really hit home with me, which was, you can't walk on water if you don't get out of the boat. And I think if this pandemic has taught us nothing else, let's get out of the boat. Let's try new things. Let's bring that innovation to the forefront. Let's challenge the way we work. Let's look at new way of working. You know what? 2020 has shown us that we can do anything. And I think now is the time that we should embrace that and move that forward, and not let go of it, because I think if we let go of it, we'll lose that momentum, and we shouldn't lose that momentum.
Well, that's an excellent sentiment to finish on. And that is where we are finishing. Unfortunately, we are at the end of our time, and we are respecting your time today because obviously everybody is extremely busy. We've had more than 750 nurses on this call at this event today. So thank you so much for spending the last hour and a half with us. A few very quick thank yous. First of all, to Aisha Al-Mari, such a privilege to hear from arguably the most senior Emirati nurse working in the UAE at the moment. And Jennifer Deeney joining us all the way from Liverpool this afternoon. We appreciate your insights. We appreciate your experience. Thank you also to our partners, Informa and Sonova, who have joined OBIX Middle East in making this session possible today, and to the 750 plus nurses on this call, and for all of your questions. My biggest struggle today has been in keeping up with the number of great questions that we have had coming into this forum. So I love the fact that you've thought so deeply about what our speakers have been saying. And we'll do it all again. We look forward to seeing you all at the next Nurse Leadership Forum. Enjoy the rest of your day and stay safe.